Felix and Tony. Come on, show Adam. Felix and Tony. Come on, show Adam. They're the right reason for a new season. Together we rise.
Well, good morning and welcome back to another episode of On the Trail with Felix and Tony. I am Felix Camacho. I'm running for governor in the upcoming 2022 general election. And joining me every week and every moment on the trail of the 2022 campaign is my running mate, Senator Tony Ada. Senator.
Fade.
Good morning. Well, we started this podcast at the beginning of our campaign leading up to the primary elections. And now that we're past the primary, it's time to shift gears as we head into the general. And here we are with about 7 weeks to go. We want to invite everyone to join us and remember that all are invited, Republicans, Democrats, and Independents. We welcome all.
Everyone.
And we encourage everyone to exercise your right to vote on November 8th. Actually, early voting begins
October 10th.
October 10th.
October 10th. So,
Okay,
you know,
to that.
when they get to go down on early voting, don't forget that, Camacho Ada, Governor, Lieutenant Governor.
And remember, it's really critically important. Only 40% of those who registered came out to vote. The remaining 60% is what we are encouraging to get out there. And those that have not even registered to vote, please register. Again, there are registrars out there that are seeking them, and we encourage you to participate. Don't sit this election out.
Yeah.
Make a difference. We are in the valley of decision, so make your vote count.
And I think also equally important to know is that I think when they use the electronic voting devices that there is 2 pages there, right? I think that they have to continue to scroll down so that they don't only see one side of the ballot. They have to continue to scroll down on the screen to see the other side of the ballot, which is the Republican side of the ballot as well.
I think there were other issues, I believe, that came up with regard to those that went to vote. And if they had renewed their driver's license or got a new driver's license, the mistake was, I understand that their mailing address was identified as their voting precinct instead of their actual
Voting district.
The village upon which they live.
Right.
And so many voters were turned away and directed to another precinct. Perhaps many did not go and just called it a day and went home without voting. So I hope they rectify and correct those problems that are still there.
Yeah, it's also important to know that they need to exercise their right, and they should not be turned away. They should allow them to vote, and it, I believe, would be a provisional ballot that they would be voting on. So, don't feel discouraged that if you go there and your name's not on the list, that you still have that right to vote, and they'll figure it out at the Election Commission.
You sure hope so.
Yeah,
And so today, I know that let's begin with the clearing the record section.
We got to clear this record, definitely. And clearing the record for today is Director Lacia Casil's comments on the Camacho Ada's 2K Memorial Run for 9/11. It's unfortunate, Governor, that we have a director of an agency that has so much time to concentrate on the Camacho Ada campaign that the director cannot concentrate on the agency that they're appointed to watch over. And I'm not sure if you heard anything coming out of the Hagåtña Restoration and Redevelopment Authority in the past several months, because I haven't.
Well, I certainly haven't. I do recall that they had some kind of a pageant down on the backside of the museum in Hagåtña.
Yeah.
That's about all I can recall hearing over the last 4 years.
Yeah. So the agency's main purpose is to get their master plan passed and to implement the master plan. And they haven't done the passing of the master plan, and they definitely haven't implemented. And I just don't see how the director has so much time and energy to go on the radio and then also the media, the print ad, and have so much to say about the Camacho Ada campaign. I mean, if that's the case, what the governor should do is, save salary of $85,000 a year and have her be the spokesperson for the Angaro Tenorio campaign. And, let's not waste taxpayers' dollars on on that agency to go out and just campaigning for the administration. That we do have the article, and
Yes.
if we can ask our producer, Mr. Boo, if you can just show the article of what was said by Director Casil. And she called our fundraiser insensitive. And actually, it wasn't a fundraiser. It was a get-together of individuals. The money that was raised took care of paying the expenses for it. The campaign made no dollars from this. And it was a run that was well attended. We had so many people out there. We had our firefighters that were out there as well, and participated in this run.
We had children. We had families.
Yeah.
We participated ourselves, and it's disheartening to see that when we come to remember and to honor those that had lost their lives in 9/11, the impact upon the nation. Many of our youth nowadays don't even know the significance of that event, but the mere fact that you're there to remember, you're there to honor, and tell the story for the next generation that needs to know the history of what happened on 9/11, well over 20 years ago.
I mean, we
It's
even
important.
had First Lady and Annette lighting
Light
the
a candle.
candles for the 9/11.
Yeah.
We had a prayer, and then we started the 2K, and it was really great. Got some photos showing up there, and I believe we have a video of the firefighters that were walking. When on that photo there, where it was all of us with the two firefighters, we presented them some pins from the 9/11 Memorial Museum from New York City.
Amen.
So it was really such a great event that to memorialize and remember those who lost their lives on 9/11.
Yeah, and the thing about it is, it was so amazing to see them totally organic. They showed up. They did this on their own initiative, and we really respected them for doing that. So I just want to thank them for showing up, and they're, of course, their family members that carried the flag, representing the Guam Fire Department. So an
Yes,
amazing thing. Unfortunately, it is a political season, and some will take an opportunity to take a pot shot at something that was well intended.
I mean,
Honorable.
even Candid came out with an article on Hagåtña Restoration and Redevelopment Authority about what have they done in the past years that they've been and look at that, they 4 years, $1 million in one pageant. So I guess Director Casil changing her position from being a director to being a campaign spokesperson, and then perhaps that's what they need to do is free up that department.
Well, the thing you have to remember is that cumulatively the $1 million that they've gotten in appropriated funds to operate this, and those are local funds that are appropriated out of the general fund, does not include the federal and pandemic funds that were also received, if any.
Right.
And so that's a lot of money.
Yeah.
And
So again, for 85,000 a year, I guess they need to just make her become the spokesperson for the Lou and Josh campaign and save us taxpayers $85,000. But with all that said, let's move on into the next.
Yes, well, I think let's talk about the on the trail this week. There are so many activities, it almost becomes a blur. And you move from one day to the next, and always filled with a lot of exciting events and being out there among the people. Perhaps you can begin to share on some of the events that we were at with, for example, Dr. Tom Shea's 26th anniversary celebration down there at EPOW with Bubba B.
With Bubba B, it was a celebration that was Dr. Shea has really gone above and beyond in celebrating his time here on Guam, advancing women's health, right? And for him to always continuously put celebrations out there, recognizing his time here on Guam, it benefits everyone. And Dr. Shea is also in memory of his mom, I believe, the Sei Shuying Scholarship Foundation, right?
Mhm.
They have his scholar athlete every year, and everything that he does is always about promoting good health and also promoting women's health. So
In talking with him, I asked him, Dr. Shea, how did this all begin 26 years ago? He said, after having gone through and being part of the U.S. Navy, going on to medical school, he was given certain options of where to serve, begin his medical practice with the U.S. Navy. And, of course, it began with, I think he had options for Coronado down in perhaps San Diego. Hawaii was an option of where he comes from, of course, and Guam. But he was sent to Guam, and he's been here now 26 years. I asked him, how many babies have you delivered? He says, over 10,000.
wow.
Tremendous contribution to our island, and he's very passionate, of course, about healthcare on this island.
Yeah, my grandson's one of those babies he delivered. So Ryan is Dr. Shea baby. So
Yes, and also with our two children, Maria, grandchildren. Maria just had, I think Misa was delivered by Dr. Shea.
Yeah.
Our youngest and only granddaughter right now.
And then we had the 9/11 Rotary Club of Northern Guam, the wreath laying ceremony up at Two Lovers Point at Peace Memorial. That was very touching, and when we get all the everyone in the community involved in what's going on, and that's what I guess different functions throughout the island that was happening on 9/11. Just goes to show that we continue to memorialize those who have lost their lives in the attacks on 9/11. Then we had our 2K also on that day, on Sunday, and then we had the Guam Hotel and Restaurant Association 50th anniversary. That was well attended as well.
Quite an event there.
Yeah.
We had, of course, our wives have been very active in the campaign, and both Joanne and Annette have visited the Senior Citizen Center, I believe, in Talafofo.
Right.
And joined them in playing bingo. They've had a wonderful time there. Visiting employees and different businesses throughout the week has been tremendous. And for me, I what I'm looking forward to, and it's not necessarily on the trail, but this week on the 23rd, my beloved mother will be turning 94 years old.
Wow.
Our Nana will, otherwise, they call her Auntie Lou, Auntie Dudi, but she is Lourdes Duenas Perez Camacho, 94 years strong.
Wow.
And it certainly is
Such a blessing.
tremendous blessing.
It is.
So we look forward to spending time with our family and all of my siblings and the spouses and our children and nieces and nephews and grandchildren and great grandchildren. Bonana. So really looking forward to that.
Enjoy the celebration.
And it really talks about health and how would I often asked her, Mom, what's your secret to have lived such a long life? And she says, first of all, it's my faith in the Lord, the blessings, the grace and mercy of God, living a faithful life. And then, she says, you have to remember that I grew up in a generation where we lived off the land and off the sea. We raised she says my father had cattle, and once a month they would slaughter that and pati it, with familia.
Right.
They'd keep what they need, but every other part of the cow that could be shared was shared among relatives and friends. They grew the vegetables, they grew their fruits, they caught their fish. She talks about how they used to make their own salt, the asiga.
Yeah.
And she says, so everybody talks about organic, but we lived organic, And then the war comes, she says, and with the war, everything changed. We lost all our livestock, and we lost our farm, and everything was now preserved or canned meats and other types of protein that we needed, the rice that was imported and the like. And so she says, yeah, your generation now grew up with a different type of nutrition and what's served and put on the table. A lot of it now being imported. And so, I think we can talk about the topic of the day, which should be healthcare. Why don't we do that? Thank you, Nana.
There we go.
For that life lesson.
This segue right into healthcare, one of our pillars.
One of our pillars on our.
And that's and actually, when you think about it, that's investing in a healthy lifestyle, healthy communities, right? And that's what we got to do with our generation today, is continuing that trend of a healthy lifestyle. And when we think about it, eating the foods and naturally that comes off the lands, and like what your mom did then, with the cows, and they share it. Hopefully that continues to be something that we look forward to as well.
Yes, and when we talk about healthcare, we're talking about investing in healthy communities and lifestyles. We're talking about a self-sustaining hospital. We're talking about modernizing healthcare facilities. We have to focus on our mental health services that are being offered, our public health services and the facilities that are there. The foundation, of course, for public health and accessibility to healthcare coverage, which is a big issue right now with a changing landscape and all that COVID has brought upon the cost of providing healthcare, and the mandates of 100% coverage of all these have driven the cost of healthcare up for all. We talked about the Guam Care Plan. We pre-approval of vendors offering healthcare, eliminating the year-to-year negotiations that are very, very. It's very contentious. Not only that, but it is a long, drawn-out process, and we need to take a look at having longer-term types of contracts that would be negotiated, and the like. We have to talk about the budgetary and benefit parameters within that. And then, of course, possible set-aside of premiums to offset either increases to subscribers or losses to insurers. So it's a huge topic.
And we'll be right back.
All too often, governments do too little in some areas, but too much in others. The Camacho Ada team wants GovGuam to provide basic services and otherwise stay out of people's lives. Government overreach will not happen in the Camacho Ada administration. And they believe in 3 co-equal branches of government, not having one exert power over the others. For more on Felix and Tony's plans for government services, visit CamachoAdaForGuam.com.
I'm Felix Camacho, and I approve this message.
And now, back on the trail with Felix and Tony.
But I do have to say that in talking with physicians that are out there serving our people, the consensus is that the health care of our island and our people is in the worst shape it has ever been. And the GMHA condition, Guam Memorial Hospital condition, is in shambles, and it is a very dangerous situation, not only for the patients that are going there, but for the employees that are working there, the physicians, the nurses, and all the other healthcare providers and everyone involved in that facility. It is a very dangerous situation that needs immediate attention.
And I heard that the administration at one point was trying to get someone in to, do some type of accreditation, but at a less, what do they call it?
Well, less than a joint commission accreditation.
Accreditation, right?
Which is the highest level of industry
the premier
standard.
of
Right.
accreditations.
And so, if you're going to get another agency to come in that would not offer such one as the joint commission accreditation, something of a lower level, just to say that yes, the hospital is a safe environment, then I don't think that's a good path to take. And certainly things are out of control.
Yeah, I mean, when the rains this past week has proven to be more than just rains, and that the hospital has really suffered by the leakage all over the place of the rain. It's like not having a roof at all, right? And the water just coming through. I think
We've seen it all.
Not just the hospital, but even the employees. The concern of their safety. When you see and you're walking through the hallways and you see a hospital blanket on the floor trying to soak up the water,
Or
where
a
does
bucket.
Yeah,
Or
where,
bucket.
where does that blanket go after that? We just had it on the floor, so it's gonna go and get cleaned and what? Does that become a damaged item now, or is that gonna be on someone's bed after it gets washed? I mean, so all these issues that are pressing with Guam Memorial Hospital, the leadership there has not addressed a lot of the things that are going on, and I think one of our candidates has, this past week was trying to see what was going on in the meeting at the Hyatt. Seems like they had money to go out and have a meeting somewhere else instead of the conference room. And what became of that meeting? What was the product of that meeting that they had, that it was so important to have at a hotel? And did the people of Guam benefit from it? But most importantly, did the hospital benefit from it?
Really, it you just have to wonder, with all the money that the government has received. I know during the debate, the governor was professing that she is a nurse, and that she has compassion and that she cares. And at the start of her campaign during the previous election, she said that she would take care of situations. And if she is a nurse, then why didn't she take care of GMH? We got it accredited. She was critical, saying, well, it was lost during Eddie's administration. But with all the money in the world that we've had, well over $2 billion during this pandemic period, why weren't these issues addressed when you have the money? In fact, there's still roughly $300 million sitting in the bank right now. And with plans to build a hospital, $1 billion facility up north in Manila, down by Eagles Field, that is a dream. And we all know that cannot be accomplished in the next 4 years or so. The problem is now. The problem is immediate, and the situation has to be addressed. You can't put this off saying, well, we're going to just live with this, and by the way, we promise you we're going to build a new hospital. That's what's on the table. I don't think that is sufficient right now. During this COVID period, I know that GRMC received their accreditation. And the thing is, it's not with the personnel and the management that maybe is from the Philippines, as they are affiliated with Medical City out there, but rather it was with our own local talent and with our local management teams that have been able to get the highest and best of accreditation for GRMC, while our hospital has not. And so there is a very dire situation. When you think about the comparisons in efficiency that are ongoing, GMHA has roughly 1,300 employees for roughly 100 beds. GRMC has roughly 700 employees with perhaps
I think 134, right?
134 beds. So when you think about it, it's the ratio of full-time equivalent employees per patient. The efficiencies are shown when you just do the average. Roughly national, I believe it's about 4. That would be the ratio of 4 employees per patient bed. But it's well over 10 at GMH.
Almost 14
or
employees
16,
per bed.
somewhere in there. And I think within GRMC, it's roughly around 5. So we're talking about efficiencies. And I understand recently they've been spending about $5 million or so for recruitment of healthcare personnel.
Well, we just had that, they had that included into the budget.
Okay.
With that $5 million going to GMH to recruit, specialty doctors. The problem is, how are they going to afford to keep that specialty doctor on payroll after they recruit them?
Yeah.
It's, I mean, we haven't, at least I haven't received any of the documents that I requested from GMH, the hospitalist compensation report. And that's the report that says how much the doctors make at GMH, and so that we can get a better idea and a better understanding of what is being compensated to the doctors at GMH, and how is it in versus GRMC. I mean, is the government of Guam, is the people of Guam getting the best care and receiving the best care for the dollars that we're spending at GMH.
Well, I think that points to a real concern is that it seems that the approach would be if there is a problem, just pour money into it, more and more money into it. Just turn on the spigot and pour more and more money into the situation, and it'll get resolved. It kind of reminds me of the health of the economy, the health of the businesses as we go around and meet people in the different industries that are there. Some have benefited during this chaotic situation of COVID-19. Others haven't. And the general consensus out there is for the businesses that are involved in tourism, transportation, retail, and the like, they are just simply trying to survive.
Right.
And so the health of our economy, the health of our people, the concern that many have had with the shutdowns of the schools, the shutdowns of the churches, the quarantining at home, the mandates for masks, the mandates for vaccinations, the freedoms, the oppression, all that has happened. There is a tremendous hurt right now in our community that is beginning to manifest, and even the drug epidemic that is out there and is very obvious, and the crime and the violence. It's really sad. I just want to point to one of the funerals that I had gone through and attended for Petra. And this was a homeless lady that had passed away on the bench over there by Micronesia Mall. Many had driven by, of course, and they would see a pile of clothes and an umbrella. And I was asked, would you come and just share a few words at her funeral? Because I know that you've been involved with, and your group has been involved in feeding. And that's certainly one of the areas around Route 16 and Harmon Loop and leading up into Dedido and by the church and the park area. Even across the mall at that main intersection where you can see various campsites of people that are living there and also working the streets at every corner, asking for money and help. I had reached out to a couple of individuals that had actually provided a meal and assistance to Petra over the last close to 2 years. And one gentleman said, I would go to the bus stop, and Petra, of course, was on the bench by the bus stop, and I would present the food tray, and she would just very gratefully and thankfully, receive it and say thank you. Not much communication. Another individual came and said, well, here's my testimony. She says, yes, she's passed away, and as I had gone to the bus stop and presented the food and also gone across the mall, they had told me that the night before Petra had passed away, she had gone across the street to the gas station or the service station and began to cleanse herself, washing her hands, her arms, her face, her hair, preparing herself as if she knew something was coming. And it was the following morning that they found her passed away. But the woman had shared that, not to worry, as she was explaining to everybody that she had given her life to the Lord, that despite all of the challenges that she had in her life, that she's in a better place now. And the stories that were relayed by other family members were that, Petra originated from the island of Yap, and she had a dream of serving in the armed forces of the United States of America. I believe she was stationed up in Colorado Springs and served as a postal clerk primarily. Colorado Springs, so I'm assuming it may have been the Air Force. She had a couple of deployments into the Middle East, and after 15 years of service as a veteran, she returned to her island state of Yap, and then eventually moved to Guam in around 2006. And but many people didn't know that she was a veteran.
Yeah.
And again, you have to wonder, how did she end up in this state, and what can be done? Because the health of our community, not just the hospital, not just the public health center like in Manguito that's been shut down, not just the northern center that the personnel up there is saying this place is a war zone. We need to fix this thing up, and in my time, I know that we expanded it. We expanded even the Southern Health Center. The one up there in Manila has been burned out with an electrical fire. That certainly is a facility that can be refurbished and brought back to life to service our community. But the health of our community is really suffering right now.
Yeah.
And so we're not just talking facilities now and the services, but the overall general health of our people, the depressions, the oppression that has occurred, the freedoms that were taken away from us.
Yeah. And that's where the mental health services that
Yeah.
continue to, we need to continue to grow those services.
Absolutely.
Because it's no longer just, taking care of those with drug issues and those veterans with also with the issues of PTSD but now because of the pandemic,
Mm-hmm.
these other hidden issues that no one knows about,
Are manifesting.
are manifesting, and they're
Absolutely.
becoming more and more dominant in the community as everything starts to open back up and everything starts to try to normalize again.
Absolutely.
And that's what we're seeing now is everything that happened in that lockdown period is coming out.
Absolutely. The work is continuous. It's never ending, and something we definitely need to focus in on when we get into office, Senator. Is we're going to have to take healthcare head on, along with crime and all the many other issues that are out there.
And that's why, and you said it just a minute ago about the Central Public Health Center.
Mm-hmm.
With that not being in operation, and all those offices that were there now are spread out throughout the island.
Yeah.
It's not at one location any longer. They need to get that building renovated, and let's get the Central Public Health back in there and continue to operate, because we were talking about the governor was talking about the health campus that she wants to build up in Eaglesfield. First of all, she's taking away land from original landowners.
Mm-hmm.
Then she wants to build $1 billion facility. Would the people of Guam be able to afford the debt service on that $1 billion facility?
It's certainly something that has to be considered. And so we talked about crime, we talked about safety, we talked about healthcare, and of course cost of living is certainly there. Infrastructure, we just mentioned, even as it relates to healthcare services. Homelessness, we touched on that, and the poverty that is existing. Education, recently they talked about facilities that have to be shut down, schools. And I think it leads us into perhaps some of the questions that we ought to take that have come in during the week, and perhaps we can address that as we have a couple of minutes remaining.
Sure.
Yeah.
So I have one. Do you have any advice for me when I grow up to be a governor one day? His name is Trevin Atoikui, and he's 13 years old.
Wow, that's really wonderful to hear that somebody would aspire to get into public service. And I would have to tell Trevor that the public service is definitely a sacrifice. I would encourage you to get as much education as you possibly can, and but also get out there and work in the community, in the private sector, and understand what it's all about to make a living. Understand the struggles of people, because ultimately, whether you become a lawmaker in the legislature, whether you become somebody that's working in the judicial system, whether you're working as a public servant, it's all about public service. And you should aspire to become what's called a servant leader, because you serve the people first and foremost. And so aspire to be a servant leader where you put others before yourself. And
he perhaps could get involved in youth Congress.
Absolutely.
Yeah. So he can start to know what the process of introducing bills and becoming a youth senator, and then eventually moving up and becoming a governor one day.
Wonderful.
Yeah.
Thank you.
Any other questions?
Yes. I got one from Alyssa Ashley. With the rising price of gas, will your administration work to improve public transportation as well as implement other modes of transport such as cycling or walking? I've realized Guam has become increasingly car dependent. following the example of North America, as road infrastructure has prioritized POVs and completely ignored other modes of transport. For example, the lack of dedicated bicycle lanes that are not shared with car lanes and the conundrum of disappearing sidewalks.
Yeah. So with that being the issue with the bike lanes, and because the easements on the sides are only go so wide, the roadway, and sidewalks now are much wider than they used to be because of the power pole. And I think it goes way back in the day where they were putting power poles right in the middle of the sidewalk, and so they build the sidewalk to go around the power pole. And if there's a way that they can actually there is a law that's supposed to, that anytime you're redoing a roadway, that you're supposed to integrate sidewalks and bike lanes with it. So it's just a matter of the planning process of having bike lanes integrated there. I believe that we need to continue to work on mass transit, and that's what I know there was an issue of lack of buses, the turnaround time for the transit buses to pick up and drop off. And those are going to be issues that are going to hit us with a ton of bricks because they're currently they're still trying to plan for the plan with Guam Mass Transit, and we need to get out of that. We really need to do something about the Mass Transit Authority. When you look at what's been happening lately, I think there are more companies now bringing in electric vehicles, and now there are electric motorcycles and electric bicycles, right? So this helps out with less pollution, more friendly environment for those that want to not drive a car and just ride a bike.
Well, I certainly recall the 2030 Federal Highway Master Plan that we had gotten approved working with the feds back in my administration, and many of those major highways, of course, and roadways, secondary roads were improved, and the work continues. We do know that there are other jurisdictions. If we take a look at what other island type of communities have implemented in trying, I know that Hawaii has tried to implement a rail system going into Honolulu, but yes, it's only a matter of time. We're restricted by our boundaries. Yeah. And what can we do to improve it? So taking a look at the master plan, proper implementation, many of secondary roads that need to be paved and properly addressed have been brought to our attention. Sidewalks that need to go, where more and more pedestrians would be there. Certainly driver education, to be aware of those that are riding their bicycles or even those on mopeds, because you see more and more people actively involved on either mountain biking or road bikes along for their health and exercise. But there needs to be a concerted effort throughout the community to address this. Yeah. Ride sharing, there's so many different plans out there. But yes, mass transit, we've done that. Many also helping those with disabilities to ensure that they have proper modes of transportation from throughout the community would be necessary. Tourism has done a great job in it, and that'll be revived again. Right. And we've had the trolley system going around, and even local residents have taken advantage of it. But it's only a matter of time before more and more cars get on the road, privately owned vehicles, POVs, and congestion continues to grow. And I recall the days of 2 lanes, one lane in each direction, and now expanding. So it's all part of the growth, but we do have to find ways and methods of improving transportation and providing for those in need. And even on our platform, we talk about the building of infrastructures for electric vehicles, those type of things where we continue to be conscious of the environment, and hopefully that when major roadways are reconstructed again, that just like in the States, right, you got a dedicated bike path. There is a dedicated bike path on the main road, and it may come down to that one day, and we'll see how that goes. But
we're looking forward to addressing it.
Yes.
Yeah.
Okay. Any other questions or?
Got time for one
I think that's that should be it.
more?
Yeah. So Senator, here we go, and I just want to thank all those that have joined us today, and perhaps you can wrap up the show there, Senator.
Thank you. So your vote matters. There's 51 days until the general election, and you can register to vote by going online to gec.guam.gov, register, or you can go visit the Guam Election Commission office at the Oka Building in Tamuning, or by calling our headquarters at 671-475-2222. Early voting begins October 10th and ends on November 3rd. We also have our Friday night remix that are coming up, September 23rd, October 7th, I believe, and October 21. And they can also register at the Friday night remix to vote. There'll be entertainment, there'll be food trucks, and there'll be vendors there as well. So, come on down and join us. It'll be at the Camacho Ada headquarters in Tamuning, right across Docomo Pacific, adjacent to Bank Pacific as well. You can ask questions through our social media. Engage with us on the trail by asking us questions through any of our social media platforms on Instagram, Twitter, and Facebook. Your questions can be sent to us in text, audio, and video, and I'm still waiting for an audio or a video message to come in. We look forward to engaging with you in the digital space and answering your questions on the show. Join us for our upcoming events this week, which was the Friday night remix. So please, don't forget about that, and we'll be that's September 23rd again, October 7th.
It might be a Nana's birthday though, but you got me covered, right?
Hey, yeah, you're covered.
Thank you.
And October 21st, and we hope to you continue to join us on the trail. It's an exciting time for both of us and our Camacho Ada team. And with that wraps up this show.
So we look forward to having you all join us next week on the trail with Felix and
Tony.
Oh, thank you. Have a nice day.
Off a day.
Have a day.
Felix and Tony.